sugary environment, washing away the acidic environment, and therefore you are actually protecting your teeth.
Exactly.
Simple. SIMPO. Simple. All right. Understood. Okay. Right. So sticky foods, sugary foods. What about our favorite carbonated drinks? Sodas. Some say soft drinks. Right? Whatever makes it fizzy adds to the acidity.
Exactly.
Am I right?
Yeah.
So let's talk a bit about that quickly. Which one of you take that?
So exactly that, carbonated drinks, and I know because I have a ridiculous sweet tooth, and what I have over time painfully learned to do is to restrict my intake to certain intervals.
Charlie. Coca-Cola for life.
But that's what you
Coca-Cola is a drug.
It is. No, and we can have this
right,
discussion
we can talk
another
about
time.
That
but
yeah. Don't mind
it's
me.
exactly that. It is extremely addictive.
Right.
The feel of the fizzy drink in your mouth.
Charlie.
So it's funny when
especially
I go
when
to,
it's chilled.
Especially when it's chilled. That fizzy feel is one thing.
Okay.
The sweet is another. And if it's Coke and it has any of these other things like caffeine and things, that's another thing you're having to deal with.
Okay.
So if you take carbonated drinks, you are dealing with a 3-pronged attack on your teeth. Now, if you want to deal with carbonated drinks, we always say, okay, one, you want to use a straw.
Okay.
If you find that you are in a situation where you really just can't do without it, you want to use a straw. Why? Because we feel it helps to reduce the exposure of your teeth to the sugar.
Okay.
Is it the thing that you would say, this is going to make sure my teeth are protected? No.
All right.
But it helps.
You'd rather I didn't take it.
I'd rather you didn't take
That's
it
the
at all.
advice.
That is the
Folks,
advice.
hit on the advice, not my jokes.
Exactly.
You'd rather I didn't indulge or overindulge in carbonated drinks, sugary stuff and all that.
Yeah.
Okay.
The other thing is that we find that people have a tendency to sip. And what we say that you want to gulp, not sip. So what that means is that you don't want to be, I have a little bottle of Fanta next to me and I sip it every 5 minutes and I'm sipping for about an hour.
Okay.
Because what you realize is that, like what Dr. Josephine said earlier, Dr. Kwachi said earlier, you are prolonging the exposure of your teeth to this sugar. So you want to gulp it down quickly rather than be sipping it over a period of time, because then, again, you are prolonging the acidity in the mouth over a period of time.
Okay.
So we want
Hang on. I'm counsel for the accused being the soft drinks.
Yes.
And I'm putting to you in the dock. So when they say sugar-free, and we see it on a lot of products, what do you dentists say? And what do you know? Sugar-free, right? So I drink more, it's sugar-free, but what's your advice? Just spot advice.
Okay.
Yeah.
If it's truly sugar-free, I'm okay with it.
All right.
In terms of the teeth.
Okay.
So xylitol and some of these other sweetness, I'm perfectly fine with it. Now,
The other sweetness are good for our teeth? Or better? Safer.
than sugar.
Okay.
Now, if you're talking about metabolically, the endocrinologist may tell you something different, because they will tell you that your body will still respond with insulin to the sweetener because it's trained to do that.
Okay.
But teeth-wise, we are okay with it because it won't produce that acidity in the mouth that sugar will produce.
Okay.
Yes.
All right, folks, you just joined us. You just heard the jury speaking on sugary foods, things you should avoid in the interest of promoting, enhancing, and securing and maintaining your oral hygiene. Okay, we've been learning that it's linked directly with your overall general health and well-being. So that's what we're talking about. Questions are welcome. 055 11 11 997. That's WhatsApp. We're live on Facebook and YouTube, and it's past half past the hour and a bit. So I will activate the phone lines because you guys love that. 030-221-6541, 030-221-6541. Ask the questions, drill the dentist, retaliation time. So 030-221-6541. WhatsApp is 055 11 11 997. I have Dr. Josephine, Dr. Bennett, and Dr. Yao, all from Platinum Orthodontics and Advanced Dentistry. Coming up in a bit, we'll talk about the electronic toothbrush as compared with or relative to the conventional old school manual toothbrush. So my phone lines are active. Let me just do a bit of the WhatsApp messages. Hey, yeah, Nafenya. Yes, happy resurrection to you as well. We are here because he paid, ultimately paid. Good afternoon. How do we identify bad breath that may be coming from ENT or gastric or psychological? Now, you know the thing already, eh? The things you've listed tell me that you are in the business, right? But that's a question we'll flag for response, okay? So how do we identify it, right? The listener, the message suggests there are different categories coming from ear, nose, and throat issues, gastric, he's going lower down, then he comes to psychological, bad breath, okay? My guests have noted that. WhatsApp is 055 11 11 997. So yeah, what were we doing before I did that? We're going to answer. We've done the sugar part.
Yes.
Okay.
So,
any other foods?
Yes. So I also wanted to add that one thing Dr. Akwachi mentioned earlier was the role that saliva, and also Dr. Bennett mentioned that it's so key. Saliva is so important to us. You know, it's funny that you pick a job where what you love is to hear people talk about how much they produce saliva.
Okay.
But
just a sec. I have a caller on the line. Let me just quickly clear my lines and then come back. Hello. Good afternoon.
Okay.
Hi, who am I speaking to?
Happy Easter.
Thank you. Happy Easter to you.
Okay. I told you about it from Tema.
Yes, Oti, quickly.
Yeah, last week the cancer of the teeth, the ring was chronic. And my question today is, sometimes someone is brushing and you see the blood from his mouth. What brings that in? Is that from the inside the teeth or the gum of the teeth that always have the blood?
Okay.
That the brush, the toothpaste is using, it's what brings that.
Okay.
That's something there that brings all that over the blood issue there.
Great stuff. Oti wants to know where the blood comes from. Is it from within the tooth when you're brushing? All right. And that's his question. Last week he asked a question about oral cancer. We didn't quite address that or give him a response. So that's what his question is. Yeah.
Okay. So just quickly on saliva. So the other foods that you want to be careful about are foods that affect the hydration of your mouth.
Okay.
And so things like alcohol will typically dry out your mouth.
All right.
Alcohol will also probably get you to urinate a bit more, also causing systemic dehydration.
Your mouth should not be dry.
Your mouth should not be dry.
Okay.
In fact, what you will find is that in a lot of cases, people who complain of having bad breath may actually just be experiencing dry mouth from not having drunk enough water or not being hydrated enough.
Right.
You know, so sometimes you want to even check and see, am I drinking enough water?
Okay.
In the temperate areas, they say they need to drink at least 3 liters of water per day just to obtain optimal hydration. I suspect in the tropics, you may need to be drinking a lot more. You know, so if you're not drinking at least 3 liters of water per day, chances are you may not be optimally hydrated.
Right. So you're seeing a linkage between your intake of water and your oral health, right?
Yes.
It could be washing away some of the stuff you need to get rid of anyway, but your mouth should not be dry, right? It should be well and properly, optimally hydrated.
Yeah.
So take in a lot of water. Can I replace, substitute water with Coca-Cola, yogurt, ice cream?
No,
it must be water.
It must be water.
As God made it.
As God made it.
All right? I know my stubborn academy people. Right? They'll say, well, I drank this and I've taken in fluids.
Yeah.
Right? Okay. Well noted. Oral cancer.
All right.
Who's
So,
taking that? Okay.
yeah. So, you know, oral cancers are such a broad field that it's not easy to give one answer in this period.
All right.
What we always advise, though, and we've said this over and over again, that when you go in for your dental checkups, and please, we have to go in for these dental checkups, everything that happens in your mouth isn't necessarily painful.
Okay.
And like I said last week, usually by the time it becomes painful, you're already tipping towards the point.
So what you're saying is that it may be symptom or pain-free,
Yes.
but it's still trouble.
But it's still trouble.
Okay.
And what you will find is that we have what we call pre-malignant lesions. So basically, this means that you have the step before a cancer,
Okay.
and you want to identify it in that stage before it becomes cancerous. So when you go for your dental checkups, your dentist will be looking in your mouth to look at, do you have any signs of these lesions? Sometimes it's an ulcer which is not healing as quickly as it should. Sometimes these are white plaques in and around the mouth. Sometimes there are reddish patches around certain areas where there shouldn't be. So they are looking at all these things, and then they interrogate and ask, oh, how long has this been here? Have you had this for a while?
Okay.
You know, and they are looking at all these things to try and determine if you are at risk of developing mouth cancer.
Okay.
So it's important to have these checkups, if nothing at all, just to help you to determine if you have any of these risks available.
Right.
Then they talk about the things that we call risk factors. Cancers, nobody really knows the cause necessarily, but we have what we call things that predispose you to developing them.
Okay.
So things like smoking. If you're smoking, chances are you're at risk of developing any of these, whether oral or lung or any of these cancers. If you are in the habit of, you know, there are certain foods that we find are linked, you know, so chewing of certain nuts, you know, we found that over time they may be linked to developing certain mouth cancers, you know. And then also there are just these situations that you really can't tell if the person has any risk factors or not, but familiarly maybe they had someone who developed a cancer, and so they are more at risk than the other person. So there are all these things that are involved, and you have to take the time to actually interrogate them.
Okay, great start. 40 minutes past you have 20 minutes less. Can you imagine? Okay. Phone line still active, 0302-221-6541. Ultimate Health on Joy 99.7 FM. We are in your mouth, right? We are in your mouth, right? With professionals from Platinum Orthodontics and Advanced Dentistry. Any questions, concerns? Phone line is active. We're live on Facebook and YouTube as well. Somebody wants to know about chewing of ice cubes. We talked about hard stuff compromising oral hygiene. Ice cubes. Anyone?
We do not recommend chewing hard things, which include ice cubes, just because this puts you at risk of cracking your tooth.
Okay.
And eventually losing the tooth if it's cracked to a point where we can't put back.
Okay.
And so we don't encourage that you chew hard things with your tooth, including ice. Yeah.
Alrighty. Okay, I know you like the gru, and there's different types of gru that we like, but you may be putting your teeth at risk, and you can get some very fine cracks or fractures that you may not be aware of until it's too late and too bad, right? Okay. Question: which people should be using sensitive teeth or toothpaste for sensitive teeth? Can someone on their own decide that regular toothpaste hurts their teeth, so they switch to that? Or a dentist must examine and prescribe for them? So do you prescribe toothpaste, right? Or recommend, maybe the appropriate word. Is everybody supposed to get wisdom teeth? All right. And what's the earliest and latest age people can get it? This is from Yana in Kaneshi or Kanesh, right? Quick responses to those.
I think I'll take the wisdom teeth.
Yeah.
The wisdom teeth are usually the third molars.
Okay.
So for their adult teeth, they tend to come out.
What was the term you used?
I mean, for the permanent.
You said detained.
The third molars.
The third molars.
Yes.
Okay,
so you usually have 3 molars on each side, either on the top or on the bottom. Yes. They are the last teeth to come out. Earliest. So human beings, we have a huge spectrum of how we develop. Okay. But you can see as early as 16 years, and as late as 25. Now coming in. Yes. So that's it. But the key thing about wisdom teeth is that, because they are coming in late, sometimes there isn't enough space. Okay. Because of that, they may not erupt, that has come out in a straight line in the position that we want them. They might be positioned awkwardly so that you can't clean, right? Or positioned awkwardly so that they are causing a cavity on the tooth that's before it. So basically we monitor. If you see a dentist, you definitely have an x-ray before the age of 16, and right from them we are looking at the orientation, like the position of the wisdom teeth in the bone, and then we are looking at how they are coming out. We do an x-ray every couple of years, especially if we feel like they need to be really monitored. Okay. Yeah.
Right. Great stuff. 44 minutes past. You have 2 still talking oral health, oral hygiene. Do some surgeries like appendicectomy, is that right? That's the right one. Cause bad breath. Can you have bad breath secondary to any surgery?
I don't know about that.
Not that I know.
Okay.
No, not that.
But maybe for peptic ulcer, we may have some bad breath or reflux disease, or if you have a condition where you are vomiting a lot, like bulimia, you are likely to experience some bad breath because you are throwing up a lot.
Okay. Good afternoon, Nortey. How are you and your noble dentist? Miss me a noble. Noble. Hey, we are all noble. All right, we are fine. Happy Easter to you all. Now, my question is that why in infancy, I guess, when you lose your teeth, it will come back, but old age, it never comes or is never replaced again. Hayford in Bato, right?
Okay, Hayford. So you only have 2 sets of teeth in your lifetime.
Oh.
So the first set comes out from 6 months to about 3 years.
Okay.
And then you live with that until you're about 6 years, and then a new set of teeth come.
Okay.
So after that, you don't have another set that would come up maybe midlife or your 50s or any such. So it's important to take care of these permanent, the ones that come.
You've used your data?
Yes, it's finished.
Dental data.
You can't reload.
It doesn't reload.
No.
So you have your first set up to the age of 6.
Yes.
Then
from about 6 to age 12.
Okay.
Then you're having a new set coming out.
All right.
Yes, which you use for life.
Okay. Noble Hayford in Bato, please. That's the response. So take care of them because you can't reload. All right. Okay. And that's when we get to do the specials and things. We'll look at dentures and all the other things that we do. Okie dokie. Somebody's typing. Let me just quickly. This one says, suppose I want to remove all the plaque on your teeth. How much does it cost? Can the presenter give the name of the jazz piece signature tune and the name of the composer? My 6th tune is by Dave Koz and it's called Together Again, right? So if you want to go look for it, Dave Koz, Together Again, Koz, right? And me too, my name is Nortey by nature, the presenter. All right, so coming back quickly, there was something about removing all plaque, costs, removing everything, all plaque, right? And it'll bring us into what Abiku and I have been trying to do with the electronic toothbrush and that comparison. Do you tell people you are removing all or leaving some? But answer the question. He wants to know if you can clear all plaque.
We wouldn't, we're removing the plaque on your teeth, but it's important to know that as you live and as you are using your teeth, definitely there's new plaque also forming on your teeth, and that's why you have to keep coming. So yes, we can't take out the plaque for a moment, but it will definitely reform.
She's resisting the temptation to giggle, right? But I'll go back to her. Maybe I'll get some giggles. What is plaque? Right? And why must it be removed? If it's forming naturally by itself, why must it go?
Okay. So plaque is simply a little coat that forms on your teeth. It's a mixture of the bacteria in your mouth and saliva. So you can think of it as a little colony that forms on your tooth. Usually if you run your tongue around your tooth after maybe a long time when you've not brushed it, you can feel there's a little something rough.
It's rough.
Even when you use your fingers, you see some whitish stuff around the teeth,
plaque.
and that's plaque.
Right.
Yes. Over time, if it's not cleaned very well, it hardens, and then that becomes calculus. And that's when you're looking at someone, you can see some yellow things around their teeth. Maybe some guy is moving to you and you feel like, this guy is not so attractive because of the yellow things on his teeth.
You do it today.
And things like that.
Ladies and gentlemen, she has done it. Last week was shark teeth. Some guy is coming and you are saying, Josephine.
So yes.
Anyway, but the explanation is what I need. Yeah.
Yes. Okay. So that's his plaque that has been on your teeth over time.
That's calculus.
Yes, calculus.
Right.
Yes. So those are the 2 things.
That's what you're removing.
Yeah.
Okay. And when we are brushing regularly, we are seeking to make sure
that we are taking off, or as much as possible, debulking the plaque on your teeth. Yes.
So where's this lady uses on my mouth? But hey, the explanation is what we need, and we're getting it from Platinum, the staff or the professionals there. Abeku and I got to try the electronic toothbrushes. Okay, I've had one way back in the past. Okay, keeping it charged. The earlier ones were a bit clumsy. Some were battery operated and
Yeah.
this and that. But this is finesse, right? This is high level, right? I find it very comfortable.
Okay.
Right? I find, maybe I'm biased, that I feel like she's saying, okay, run my teeth from smoother teeth.
Okay.
Right? I find that I'm more interested in effects now because you guys gave me this gadget. Right? But I have less manual
Control.
and effort.
Yeah.
Right? I can keep it in a position. It's doing certain things. It has gears, and it does all sorts of things. But yeah, I feel that it is more effective. But I have also read that you can do the same with the manual if you're doing the right thing. But overall effectiveness, they rate the electronic toothbrush higher.
Yeah.
Am I right?
Yes.
Or am I
So-
just biased?
No, that's I was initially quite scared. This is someone who moved from last week Dr. Akwachi mentioned smoker's toothbrush. I was using smoker's toothbrush at a point in my life, and I've moved from smokers all the way to where I am now.
But
And so
you were not smoking.
but I was not pleased. I wasn't smoking. Everybody who knows I wasn't smoking.
Talk true.
Yeah, it's true.
All right.
But you
The
see,
smoker's toothbrush is harsher.
it's
isn't it?
harsh.
Hard.
It's
Yeah,
hard.
it is harsh.
Yes, and when you finish, your mouth feels like your mouth has been sterilized. you
So you
know.
are terrorizing your teeth and
Yes,
gums.
and gums.
And
doing-
what was your thinking then, that you were doing a better job?
Exactly, because
Right.
that's how you afterwards your gums feel sore.
Right.
But you see, you feel that then this means I've had a really good clean.
Can you link that with Ot's question about where the blood comes from?
So it is linked. And what I would have said to that question is that there are many causes, reasons why your teeth you would bleed after brushing. Let me
Okay.
say that. The most common cause is active gum disease. So what
So
that means
bleeding could mean
could mean
that you have gum disease.
that you have gum disease,
All
which
right.
is active.
Okay.
The reason why I differentiate is that you can have gum disease which is not active, and the way you know that is whether it's bleeding or not. So if you brush your teeth, you spit it out, you see that reddish discoloration of your spit,
Right.
then chances are there could be something going on there. Now I said the most common reason is gum disease, which is active.
Okay.
And what that means is that you do have plaque which has now over a period of time attacked the gums and is causing inflammation of the gums. And you need to go and see your dentist for a consult, for a clean, sometimes what we call a deep clean,
Right.
just to try and get rid of it.
Wait, at this point, will I sense anything? Will there be pain?
Often not.
Not.
Yes,
Okay.
often not.
Right.
And like I said, that's the dangerous thing.
Okay.
The
The silent one is dangerous.
silent ones
All
are
right.
dangerous. But you could also have vitamin deficiencies. For instance, one very common one is vitamin C deficiency, which could present itself in your mouth as bleeding.
Okay.
So the most common cause, chances are it is gum disease, but it could also be caused by any of these other factors like vitamin deficiencies. In a few cases, like I said, these pre-malignant lesions could also
So,
be.
Doc, when we brush and we're doing the right things,
Yeah.
and fingers crossed, there's no underlying condition and everything,
Yeah.
when we spit out toothpaste or whatever, foam, whatever it is, there should be no blood?
There should be no blood.
Seriously?
Yes. There should be no blood. So once you're
Okay.
seeing that it's an alarm signal, you need to go in and
If you
get
see
checked.
blood
Yes.
during brushing,
Yeah.
right, then it's a flag
It's a flag.
which should be responded to by seeing your dentist.
Yeah.
All right.
Yeah.
That's an important one.
Very
Okie dokie. Right.
So I think I lost my train of thought.
No, we were talking about the bleeding,
Yeah.
right?
And then making to the electric toothbrush.
Yeah.
Excellent. So having made that transition myself, I was skeptical of electric toothbrushes because the feeling was, how could this thing clean well?
Mm-hmm.
But what has been shown without a doubt is that it cleans at least 70% better than the manual toothbrush
Okay.
with the best technique.
Mm.
And so, assuming I am brushing your teeth for you, trained professional,
Right.
an electric toothbrush would probably do it 70% better than I would.
Okie dokie.
And so, just by doing that, just by making that switch, you put yourself in a very strong position in obtaining good oral health.
Okay.
Yeah,
For those who can afford.
for those who can
For
afford.
those who can afford.
Yeah.
Okay. Don't put things you can't afford in your mouth.
Yeah.
Okay? Your pocket will spit it out. But yeah, we've Abeku doesn't want to share. Where is he today? The charcoal seller's son is wearing a white shirt. Where is he? Abeku said that he found it easier.
Okay.
He could, get into places that he didn't. His has the circular head. We have the sonic and then the
Yes.
other one, right? The motion is circular, but then the bristles are angled
Mm-hmm.
and so on and so forth. You see, I had to go and research it because I was interested in what was going on in my mouth, right? And I wanted to be able to verify or give feedback. So he finds it more comfortable,
Yeah.
right? Very silent. He
Yeah.
thought it would be like some cornmeal,
Yeah.
right, in his mouth. And then it looks like you end up brushing more effectively, but for less time and with less pressure.
Precisely.
That's what Abeku shared.
Precisely.
Mm.
Because most of the time, so Abeku is absolutely right. Access is a big one because, like you notice, the head of the brush is much smaller than your regular toothbrush.
Right.
So he's able to get all the way towards the back, especially to the wisdom areas, like Dr. Bennett said. So access is a big one. Then the comfort. The older versions were quite noisy.
Yeah.
These newer ones much quieter, and they also seem to have a timer for the 2 minutes that you
Yeah.
are required to brush for. So then again, it takes care of the duration that you have to brush, and so really, it's a game changer when it comes to oral health. Yeah.
All right, listeners, I'm going to be negotiating with these guys to see if I can get some and put it in some formula that we can give out or get some people to try. Abeku's wallet is bigger than mine, but I only come here on Sundays. He's here all the time. He's got dough, right? But we'll see how we can work out something in the interest and of promoting oral health, right? So that people can compare.
Yeah.
Okay, do they last longer or compared? You have this head you have to replace.
Yeah.
And one of the things was actually that some of us are very stubborn with the conventional ones. We can have it for years. Confess, if you won't call, I'll say it. Right? We can keep our conventional manual toothbrushes for years. Dr. Bennett, what's the recommendation? How often should we change our toothbrush?
So we recommend changing every 3 months.
Every 3 months.
But if you see that the bristles are frayed,
Every 3 months.
Yes.
Change your toothbrush.
Yeah.
Yes.
All right.
But if you see that the bristles are bent,
Okay.
then it's likely they are not doing the job properly.
Okay.
And then you have to.
How
get
does
it
that
right.
compare with the electronic? When do we change?
The electronic too is
The
about
same?
the same.
Yeah.
Yes,
Okay, okay.
it's about the same.
All right.
And I just want to chip in that because of this having. That's also another reason why if you have a dentist is important because the coaching. We always ask you, what's your cleaning routine like?
Right.
And then once you take us through, we ask you questions. Okay, so when's the last time you changed your brush head? How's your brush looking? Sometimes we ask
You
you to
guys
bring
sleep
it.
because it seems like you must do an awful lot of consultation, history taking before you even take your tools,
It's
Yeah.
important,
right?
yes. And
Do
we
you
take
have
the
time
to
for
do
this
that.
kind? Do your clients have the time
Oh yes, they do. So
to go through this whole process and coaching you how to use even something as basic as a toothbrush?
yes, we do. There are times that we bring you in just to come for sort of like a coaching session, and our clients appreciate it because
Remedial classes. I bring in my humor, but it's to carry across
Yeah.
the point. Go
Exactly.
learn how to clean your teeth.
exactly,
Yeah?
exactly.
Okie dokie.
And we definitely working with you because that's the thing about prevention. It's not really go do this, but how are you doing it? Do you think it's working? I think this is
Yeah,
what you
who's
could
taking a
improve.
picture when I'm talking about my teeth.
Yeah, so it's an interaction,
Okay.
and we are looking at what works, what we think will
Okay.
improve.
Right. So
you
even
know,
with the
our
electronic, you still need some skill, right?
Yes,
Yeah.
but not as much.
It's not
as-
unskilled labor.
Exactly.
Right? Exactly. Right. This is from Dede in Maryland. Are there dental hygienists in Ghana? Dental hygienists and dentists. Which of these two cleans the teeth in Ghana? This is from Dede in Maryland. Should the teeth be white? And what is tartar since you've explained plaque? Or is it one and the same? Are they tartar and plaque one and the same? And of course, she has a third one. There are devices over the counter that one can use to remove plaque. Are these advisable? And then how long should or can one brush the teeth? The electronic one is timed for 2 minutes. Can we do that for Dede?
Okay,
As we
so
run
I'll
out
attempt
of
to
time.
answer
Yeah.
as many as I can. So
Okay.
yes, with the manual toothbrush, yes, you should brush for 2 minutes twice every day.
Mm-hmm.
nights and one other time in the day.
Okay.
So that's the last question. Also, we will recommend that you frequent your dentist. For plaque, it can be removed even when you brush. You can remove your plaque,
Okay.
etc. But we really advise that you come in for the dentist to also do a more thorough clean.
Okay.
Should teeth be white? As Dr. Yao said last week, teeth color is mostly hereditary. Is your complexion reflects your color, etc. So I wouldn't say your teeth should be white, but it should be healthy.
Okay.
Yeah.
Right. Don't go for the aesthetics.
Yes. Let's have the foundation before paint.
Get the health.
Yes.
Okay.
Yes.
All right.
And then she also asked about hygienists and dentists. Both hygienists and dentists can clean your teeth.
Okay.
Hygienists all they do is clean. So then you're going to someone who does it all the time, every day. Dentists do other things. We do fillings, we do every other thing. But a hygienist does only cleans. So in Ghana, yes, we do have a few hygienists. Most of the time, dentists do cleans, but that's the difference between the two.
Right.
Yeah.
Okay. Good afternoon, Nortey by nature. I have this hard palate in my mouth. The upper part at the back on both sides of the wisdom tooth. It's not painful even when I press very hard. What could be, I guess, the cause? I can send you a picture if you don't mind. Godwin at Pillar 2. Can any of you take that? I think some hard structure.
Godwin, I think the best thing is to go in to see the dentist.
Yeah.
Because I have some idea what it could be, but the truth is you can never be certain when it's via text.
Okay.
Yes. So
Godwin, send me that picture, and I will make sure our guests get it, and we will build bridges with them or any other dentist so that you can get this sorted out, whatever it is, right? Thanks for sharing, Godwin in Pillar 2. This one says, is it true? Oops, scroll. I'm late in asking. My son has 4 or 5 yellow teeth. We went to see a dentist when he was about 14 years, but the dentist checked everything and said it was caused by some antibiotics. It's somewhat colored the teeth, which have remained permanent. Is it true that antibiotics can cause this?
Yes, especially tetracycline antibiotics.
Okay.
As I mentioned, the permanent teeth start forming as early as when the child is 6 months old. So some of these childhood diseases, if you give the child that drug at that age, at that time the tooth was forming and can't discolor.
Right.
So it's true.
That was from Adole in Awoshi. We're most grateful. You shared, you enriched our program. This one says, suppose, this is the person who wanted to remove all the plaque and wanted to know the cost. We haven't talked about costs, and dentists are very shy about costs. Can you polish the teeth to remove the plaque?
Okay, so what we do is scale and polish. That's the procedure, and yes, it's able to take away the plaque from the teeth.
Okay, all right. And you've written the composer is Decos. No, it's Dave Cos, right? Dave Cos. Dave as in David, and then K-O-Z or K-O-Z, or some will say Z. All right. Thanks for sharing. On a lighter note, will the electric toothbrush be affected by doomsock? Hey, man, shed and you're rough. All right. In fact, the one they gave me has this snazzy travel charger. It looks like, oh man. When I saw, I said, which one too is this? This is plenty, right? But it has a magnetic charger, so you're not seeing electrodes. It just stands on this thing that looks like glass. It's very snazzy, Abeku, let's welcome some listeners into our bathrooms there. They will run. Okay, but yeah, we're still testing it, and we're not being biased at all. Those of you who don't get any of those and negotiate, you will get you some electronic chewing sticks. Right. Okie dokie. Have I read all? Okay, the person has sent the picture. So we're wrapped up. We're past 3 actually. It's been great having you guys, and I'm looking forward to the more specialized discussions we're going to have with you. I'm interested in, of course, the presentations across the ages. Right. I'm interested in whether if I have any dental, I don't know what to call them, aids like braces or anything in my teeth, dentures, false teeth. How should I brush? How should I follow oral hygiene? I'm interested in oral hygiene and oral presentations for the elderly, geriatrics, right? Can they chew? Should they be, the teeth are worn down or this and that and so on, right? So we have so much to do with you guys. I'm going to have a battle balancing you coming in over the, program periods to see how we can get in there. I know the orthodontics deal with, they are the ones who do alignment and balancing.
Yes, sir.
Right? For crooked teeth, which I will not ask Josephine about, right? Because she has her way of, So we'll have you guys in your specialized departments to talk to us on difficult cases and regular cases that you see. And I hope that we can get some people some help as well. All right. Many thanks, Dr. Yao, Dr. Josephine, and Dr. Bennett from Platinum Oral Orthodontics and Advanced Dentistry. Right. We didn't touch on the impact of all this on your mental wellness because that's my territory, and I'll bring them in at my behest. Okay, and we'll look at that. But your confidence, your self-esteem, and many things are damaged when you are, dealing with or contending with compromised oral health. Once again, thanks, Lady Gigla, and she's Dr. Josephine Kwachi, though I tease her a lot. Yao is actually fully Dr. Yao Asamoah Edu, and Bennett is Dr. Bennett Edu, right? All from Platinum. Many thanks to you, my listeners. Flossing, string flossing, we'll do all that.
Water floss.
Yeah, water floss and all that. You want to say something to
Water floss is Pro Max, so she should water floss.
Don't joke with Dede. And I know Dede can bite. Thanks for reading my message. Who's this? Okay, the one about the antibiotics. All right, we're here for you. Seriously, we're here for you. And we've got a few other messages that we try to deal with off the main road, sidebar. Okay, because we do appreciate all of you sharing personal information about your health and your wellness. So some of them, Abeku and I take a decision to do, sidebar assistance. Once again, thank you for tuning in and staying with us. This has been Ultimate Health on Joy 99.7 FM. We have some football commentary coming up, so stick and stay. Don't go anywhere. I'm checking out. My name is Nortey by nature. Stick on Joy. I'm out.